Efforts to trace the steps of patients who tested positive for the novel coronavirus are still underway. So far, health workers have reached out to 74 people they have interacted with, and 8 of them are experiencing cough and cold. They are now on home-based quarantine.
Isolation lang din sa loob ng bahay. Ibig sabihin, wala silang privilege na makipaghalubilo sa miyembro ng kanilang pamilya habang binabantayan po sila sa loob ng 14 days.
These 8 are now part of the list of patients under observation. Just less than a week after the announcement of the first nCoV case in the country, the total number of suspected cases has more than doubled. The health department says it's now at 80. Of the 80, 30 have tested negative for nCoV, while health authorities are still waiting for the lab results of 48 patients. It takes 2 negative results for nCoV before a patient can be discharged. One of the 2 who tested positive died on Saturday. The cause of death, severe pneumonia. But in addition to the novel coronavirus, experts from the RITM found other microorganisms in the patient's body.
May iba pa na mga virus at saka bacteria na nakita.
Meron pong Streptococcus pneumoniae, which is a common cause of community-acquired pneumonia, and also Haemophilus influenza type B. Mahirap na because it's a mixed infection, mixed pathogens, so it will be very difficult which among the 3. But still, we would say that the severe pneumonia must have been caused by the corona and COVID because of the clinical and some diagnostics that show similarity between the SARS-CoV and the nCoV.
Health officials cite logistical reasons as to why they weren't able to send the samples of the 44-year-old man along with the first batch of specimens for nCoV testing in Australia. His remains are still considered potentially infectious, so health officials say these must be cremated as soon as possible. Meantime, health officials are working with the national government to identify more isolation areas to determine if there is a need to quarantine more patients. Trisha Terada, CNN Philippines.